My name is Victoria P. Williams, and I'm an osteopathic physician, and I'm starting a business called Embodied Osteopathy, where I give osteopathic treatment and I help you with your healing journey. Osteopathy is hands-on treatment that we provide to patients where we look at patterns that are being held within the body. And we use different types of techniques that we've learned in our training to either directly or indirectly bring them back into balance. What I do in osteopathy is I meet with someone who's usually suffering from something. And then we talk together and I listen to their narrative and I listen to their story. It may sound a little bit like therapy, but it's actually somatic. And then I would perform an osteopathic evaluation. And that may include where I have you sit, stand, walk, and then I actually place my hands on them and I palpate their tissue. At this point, I'm gathering a ton of information. Some I can verbalize, other has not quite yet materialized, I'm able to kind of see the story that they're talking about within their body. Through this history that I've gathered from them, I'll lay them down and I'll start to treat them through osteopathic manipulative treatment. It's not like massage or chiropractics where I'm like cracking you. As I place my hands on the patient, I can actually see the stories of what's going on inside their body. I'll begin to feel patterns, and these patterns are actually some of the things that they're holding from in the past. I can almost read this like a constellation in the night sky. What someone may want to come to an osteopathic physician for, or at least for the treatment that I do, is to actually peel back the layers of behavioral patterns that are actually causing the symptom or condition in the first place. We start to unpeel these layers, and then what emerges underneath is this amazing wisdom that the body holds to heal itself. It actually opens up a ton of creative options. Family medicine works a lot on finding a diagnosis and giving a treatment for that diagnosis. And oftentimes it's something on the outside that's going inside the patient. What I like to do in osteopathy is I'm actually not very diagnosis driven. I tend to focus more on what the underlying cause might be from that suffering that the patient's having. And you might be surprised at all the different underlying factors that can actually cause symptoms. It may not be a condition that regular Western medicine is treating very well. Someone may go to a family physician for type 2 diabetes and they're told, here's this medication, but you also have to change your diet. And oftentimes this method isn't very successful. So my hope was to bring this to the community in a different setting. And that's what I'm hoping to do through Embodied Wisdom Osteopathy.